of mine is about hepatitis E, which is caused by hepatitis E virus, and that is spread usually by drinking contaminated water with fecal matter. Living in or traveling to countries with poor sanitation can increase your risk. This is especially true in overcrowded areas. According to WHO, around 20 million cases of hepatitis E infection occur every year, and this virus targets the liver. It is more common in developing countries. Hepatitis E usually resolves itself but may develop into acute liver failure. Earlier, I posted a short video about hepatitis E on this channel. I hope you have already seen that video, and today I am going to discuss this illness in detail. Well, first of all, let me tell you the symptoms. If a person develops symptoms of hepatitis E, they show up within several weeks of exposure. These symptoms include yellowing of the skin, that is jaundice, and also your eyes can be yellow too. Also, you may have dark urine, joint pain, a loss of appetite, pain in the abdomen, especially on the right side due to location of the liver, and also your liver can be enlarged. In serious cases, if there is a complication, you may suffer from acute liver failure, and that can be fatal. Also, you may suffer from nausea and vomiting. You may also have mild fever and fatigue as well. Okay. As I told you, now I'll tell you the causes. As I told you before, the causative agent is hepatitis E virus, and this is usually caused by drinking water contaminated by fecal matter. If you are living in a developing country where the sanitation system is poor, then there is a chance that you may get infected with hepatitis E. Okay, especially in overcrowded areas. More rarely, hepatitis E can be transmitted by eating products from infected animals. It can also be transmitted through blood transfusions, and infected pregnant women can also transfer the virus to her fetus. Most cases of infection clear up on their own after a few weeks. In other cases, the virus causes liver failure. And I'll tell you the diagnosis. To diagnose hepatitis E, your doctor will do a blood test to look for antibodies to the virus. Diagnosis can be challenging because distinguishing between different forms of hepatitis is difficult. And now I will tell you the treatment. For people who have severe acute illness and who are not pregnant, treatment with the medication ribavirin, that is antiviral drug, for 21 days has resulted in improved liver function in some small studies. If hepatitis E is suspected and your immune system is not suppressed, you may not need any medication. The doctor may advise you to rest, drink plenty of fluids, avoid alcohol, and practice good hygiene until the infection subsides. Pregnant women or people with suppressed immune system or people with acute liver failure will likely be hospitalized and monitored. Hepatitis C generally clears up on its own with very few complications. In rare cases, it can lead to acute liver failure, which can be fatal. Mortality rates for the virus are low. Pregnant women are most at risk for fatal complications. People with suppressed immune systems are more at risk for developing a chronic version of hepatitis E. Now I'll tell you some preventive measures. To avoid contracting hepatitis E, be cautious about drinking unsanitary water. In developing countries, drink only purified or boiled water. Avoid uncooked or unpeeled foods. These include fruits, vegetables, and shellfish, which are usually rinsed in water. It is also important to practice good hygiene and wash your hands often. So this was my video about hepatitis E. I hope you like this video. If you have any questions about hepatitis E, you can post your question in the comment section. On this channel, I have uploaded so many videos about different illnesses. If you or your loved one is suffering from any illness for which you cannot find a video, just let me know, and if I find a time, I'll try to make a video about that particular illness. Thanks for watching this video. See you in next video. Bye for now.